Welcome, and I'm glad you're here. Uh, my name is Dr. Mary Jane Swartz, and in this short recording, I want to introduce you to the role of the CNS, and I'll give you an overview of the clinical requirements for the CNS specialty courses. So many will ask, what is the CNS? If you are interested in this track, you may already know, but let's talk a little bit about what that role is. So this is a definition put out by the National Association of Clinical Nurse Specialists in December of 2023, trying to give a uniform description that we can be used throughout locations. So a clinical nurse specialist is an advanced practice registered nurse prepared by a master's, doctorate, or postgraduate certificate level CNS population. CNSs can diagnose, prescribe, and treat patients and specialty populations across the continuum of care. The CNS improves outcomes by providing direct patient care, leading evidence-based practice, optimizing organizational systems, and advancing nursing practice. So we can impact patient care through that direct care. We definitely support the professional healthcare team, and we can be a driver of the evidence-based practice. So a CNS, if you are familiar with the APRN role, there are 4 different roles. The one that's probably most familiar to you is nurse practitioner, the nurse anesthetist, the nurse midwife. CNS is probably the one that's not as well defined or well recognized, but it is the first of the 4 APRN advanced roles, and was in its conception to be that expert at the bedside. So it has been a role for over 60 years. There are 3 spheres of impact: patient care, nurses, nursing practice, organizational systems. CNSs can practice in adult general populations within a setting such as acute care, outpatient, emergency rooms, ICUs, in the community. It can have a condition focus. You may be focused on cardiology or oncology or maybe surgery. Or you may be focused on a care problem such as wound, pain, and palliative care. At USI, we do the adult general populations. There are other schools that may offer in pediatric CNSs, and some schools are offering it in mental health. So what builds that the specialty courses? Well, we are guided by our accreditation body, which is led by the American Association of Colleges of Nursing. And you can see the 10 domains that you will find throughout the courses here at USI. We also are guided by the National Association of Clinical Nurse Specialists, who put out a statement on practice and education in 2019, and it is currently in the process of being updated. But you can see those spheres of impact clearly denoted with patient direct care, nursing practice, organization systems. But there are other things that are involved in that, such as being part of healthcare policy, maybe specialized standards of practice. What is the healthcare environment? What is your specialty practice? What are the social needs that we find with patients? Many of us may have special knowledge, such as wounds or cardiac, and definitely interprofessional collaboration is a part of that. So as we look for clinical, we are trying to hone those competencies for you so that you're able to practice when you graduate from USI. So what activities would you expect to see during a clinical experience? I probably tell you, and many faculty and many CNSs will tell you, the number one thing that CNSs are involved in is quality projects or initiatives. So one of the things you will do in the 3 specialty courses is identify and implement and evaluate a quality project so that you can get some practice in doing that. Some people have experience in that, some it's a new skill. So that's a big project that goes across all 3 semesters of the specialty courses. but you'll also be involved in doing patient consultations, product reviews, maybe doing chart reviews, looking at data. Maybe you might be involved in a community outreach project. You will definitely be developing relationships with others in the interprofessional team to a deeper degree than you are now. Providing education to the interprofessional team is important. This education is really around continuing education for the healthcare team. So it shares many principles with academia education, but it has a different purpose. And so we'll talk about that in the specialty courses. You will develop skills in coaching and mentoring staff. You may perform a system analysis, looking at what's going on in that system. Maybe conducting a cost-benefit analysis will be part of your role. You'll obviously participate in activities to enhance evidence-based practice, and you might be involved in creating or reviewing or revising policies and procedures and protocols. So we're really looking at these assignments and these activities to show the impact to our 3 spheres. So just to review, Nursing 618 is usually a course that you complete prior to going into your specialty courses. That course does not have clinical hours, but you will be purchasing iHuman, which is a web-based tool to complete assessment-based case studies. When you get into Nursing 645 or 745 for the DNP route, it is offered in the fall, 16 weeks. During this semester, I strongly encourage you to take at least 40 hours with an NP or PA or an MD in an inpatient clinical site. Majority of CNSs work in the inpatient setting, but I want to really hone your ability in health assessment, prescriptive authority, coding, inpatient coding versus outpatient. Nursing 646 or 746 is taken in the springtime over 16 weeks. And then we have Nursing 647. 747 will be offered during the 10 weeks over the summer semester. So all these have a focus in adult gero because that's what we offer here at USI. As you listen to me, you'll probably wonder, well, how many clinical hours do I have? And I've left that missing in the discussion because it is subject to change. And there's a lot happening. So just to let you know what's going on. Accreditation organizations such as the National League of Nursing and the American Association of College of Nursing have one thought on how much clinical hours is expected. Certification organizations are involved because such as the American Association of Critical Care Nurses or the American Nurses Credentialing Center are responsible for certifications, and they have minimum requirements in order to be able to sit for their tests. But we have other groups such as the Nursing Practitioner Faculty Group who are strongly pushing for 750 hours for MSN. If you're in the DNP route, you know that you're doing about 1,000 hours to get your doctorate. So the effect of that other APRN role is having impact on what the CNS group does. The CNS organization, the National Association of Clinical Nurse Specialists organization, endorses 500 hours. But we're also finding that some state boards of health, and in case you weren't aware, state boards determine what the nursing practice will be within their state. Some state boards are dictating how many clinical hours you need to be an advanced practice RN, and what kind of classes you're doing. So as we go forward, those clinical hours may change. The credit hours will not change, but how we deliver these classes may change. So the clinical hours required, you will be notified if any changes to those clinical hours, but it is ongoing where we're going to end up. So these are the courses. This is when they're offered. I think it's also important to just a little bit about clinical, that It is really a triad responsibility for clinical in the specialty courses. Obviously, the student is expected to be interested in learning, that they will follow the guidelines of the American Nurses Association and the College of Nursing Graduate Handbook, that they provide professional behavior while they're at there. Their attire, their interactions is important. And they take a proactive involvement in their education. The preceptor is involved in the clinical supervision of the student, and they're going to be asked to provide not only evaluation feedback on a regular basis, but also to verify the clinical hours that the student has done. And that evaluation is so important as we go forward. But ultimately, the faculty retain the responsibility for evaluating student performance and the quality of those clinical experiences. Faculty communicates to the preceptors on an ongoing basis. Definitely, we will, at the beginning of semesters, we tend to do it also not only in the middle and at the final, but we are always open to talking to preceptors and reaching out to them, because the preceptors need to be aware of what our expectations are, what the curriculum requirements are, what the practice courses, what practices should be in those courses, what are our objectives, what are our assignments, so that they are aware of what our expectations. Everyone will also provide feedback. So the preceptor provides feedback, the faculty provides feedback, but I also expect the student provides some self-assessment. So students will be expected to complete a mid-term self-assessment and a final assessment each semester, because it helps us to know where you're going. It helps you know what competencies you may need work on. So it's a continuous process of making sure that you're meeting those competencies. So clinical expectations. CNS students must have an opportunity to practice the CNS role in settings related to the population focus area. As I've already stated, USI offers the adult general track. I've already stated the faculty have ultimate responsibility, so it is our responsibility. When we talk about clinical, if you looked at a statement by the CNS organization, it talks about clinical hours, refers to hours in which the student implements the CNS role in one or more of the 3 spheres of impact. If you looked at our accreditation body, they talk about direct care, refers to a professional encounter between a nurse and a patient. It can be done either face-to-face or virtual, and is intended to achieve specific health goals or achieve selected health outcomes. They define indirect care refers to nursing decisions, actions, or interventions that are provided through or on behalf of individuals, families, or groups. So as you can see, the CNS role, because we have competencies that are in the spheres of nursing and the spheres of systems and organizations, some of our hours would maybe considered indirect by the AGCN, but they directly relate to the competencies we talk about for the CNS. And so that's what we're looking for, and that's what you want to think about as you decide where you would do clinical. We've already talked about your expectations to follow guidelines, and so you are not only representing yourself, but you're representing nursing and you're representing the school to which you're enrolled. So how do you prepare? So each student with faculty approval must secure their own preceptor and clinical sites. Who can be a clinical preceptor? Well, they have to be educationally or experiences prepared to mentor students in the CNS role. So the majority of your time will be with the CNS. Whether that CNS is certified or not may not occur. Many CNSs obtain that role and that academic degree prior to a certification test being offered, and they're not eligible to take that test. So some have chosen not to become certified. But more recently, many CNSs are getting their certification. So our preference is certified CNS, but at times we may not have that. But we can also use other professionals with advanced preparation and specialized experiences that can help precept and be preceptors, such as a medical doctor, an NP, physician assistants, someone with a master's, a social work degree with an advanced degree, a psychologist or a nutritionist also may be involved. So if you're not sure who these people are, or whether you want to, or whether they would count, reach out to your faculty to do some discussion prior and explain why you think this is really important based on what you want to do for your future. Many students ask, when should I start looking for my preceptor? I don't think it's ever too early to think about that. Our organization suggests looking at a year before you plan on doing your specialty hours, because sometimes it can be hard to find. And it takes time for the paperwork to get through the system. So it would help you avoid any details or delays in your education. You can also look to the USI Graduate Handbook. It will contain answers, and I provide you the link. Documents are there so that you can be used for printing. There's a document regarding a preceptor checklist. There's a preceptor agreement, maybe a site survey that you can do, and then an initial request for a memorandum of understanding. The memorandum of understanding, or sometimes abbreviated MOU, is between institutions, between USI and the institution in which your CNS is employed. We have MOUs that are current in many states, in many locations in the state of Indiana, if you're in the state of Indiana. So if you're not sure if your organization has an MOU, you can reach out to the nursing leadership in the graduate department to see whether there's also an MOU already in place, which would save you some time. So what you consider? So what is your chosen specialty practice? Do you see yourself working in cardiology? Do you see yourself working in a med-surg unit? Do you think it's going to be oncology? What would that may be? So that's things you want to think about, and then it will help you decide who you want to be your preceptor. Do you have a population focus? Do you want to just take care of wounds? Do you want to do just palliative care patients in that adult gero population? Where do you see yourself working in the future? What is your vision of where you like to do? Consider, what certifications do you hold? Do you hold a CCRN? Because that may play a part in where you want to work in the future. What certification will you be seeking? We'll talk about two, and I'll talk about those a little bit later. USI is approved. Students who graduate from our program can either take the critical care certification test or the American Nurses Credentialing Set. Do I want to seek more than one preceptor? I strongly encourage you to work on your health assessment and do some hours with a provider whose responsibilities rely with developing that plan of care. And then consider who else may provide clinical experiences to improve my competencies, maybe an assessment, writing a plan of care related to prescriptive authority if I see myself doing that in the future. Or maybe it's someone with fiscal matters, because I don't know a lot about that and I need some help on that, and maybe we can seek it out. So talk to your instructor, talk to other nurses, maybe talk to other CNSs to help you to reach out and consider what you want to do in your education, because it is your education, and we want you to take an active role in this opportunity you have in being in school. How do you find a preceptor? Well, you can ask your faculty. We have past students at different locations that sometimes can be helpful, so ask faculty as an opportunity. Talk to your nurse manager. Are there CNSs in other units? Maybe you're employed in a large organization that has different systems that has different organizations, and you don't know there are other CNSs available to you. Maybe talk to the CNS who initiated the interest you have now, because I think that CNSs really embrace change. So find out, are there other CNSs in maybe another location? Because sometimes it's great for you to branch out to other locations. Review your state's nursing practice for APRNs. Do some proactive looking. What do I need to do to establish myself as a CNS once I graduate? Talk to a CNS in your institution. That can be a valuable source. They want to share what they've done and the jobs they've been doing. You can look at available nursing jobs for CNSs in your area. Look to other organizations that may employ a CNS. Also encourage you to check our organization website. We are working with having possible preceptors on that site. We also list the affiliate chapters. These are state chapters that maybe you might be able to send an email to send an inquiry, and they can respond back to you on possible preceptors in certain locations, because affiliate organizations are also trying to meet the need of finding preceptors. So these are all ideas of where to look. Then prepare to talk to your peer preceptor in that initial contact. Develop what questions are important for you to ask. Have they have CNSs in the past? Students. Does the site have designated CNS positions? I think that's important. Do they get to use the title CNS in their position? What type of units of patient populations are they responsible for? What are your activities that are involved in CNS? Tell me about your typical day. Are you certified as a CNS? Are you available during the days of my clinical practicum for those semesters that we've talked about? Do your job responsibilities address the 3 spheres of impact? Some CNSs are maybe removed from the bedside, so you may want to work with that CNS because she's really strong in that working with organization systems, but maybe work with another CNS who has more experiences or more activities at the bedside to balance you out. So that you can gain those strategies and competencies across those 3 spheres. It's always important to ask them, what is your institution's process to do clinical hours in their setting? Because, again, that can take time. So what forms need to be filled out? What do they need? Because it will help save you time so you're not scrambling right before the specialty courses start with who my preceptor is. So it's working ahead and being prepared will make it better opportunities for you. Here's some points to remember. So you will have to have an MOU in place with that organization, with that university or agency, and then you need a preceptor agreement. Those preceptor agreements will need to be submitted, and then they will be given a green light. So your preceptor agreements need a green light, and it takes time for those to be reviewed, and you'll get more information on where to submit them to and how they were done. It's also important that if your forms are ineligible or you cannot read or it contains abbreviations, we have no idea who that is, they'll not be processed because they're incomplete. So need to make sure the forms that you submit are the best quality possible. You're responsible to confirm the affiliation agreement has been accepted. So making sure that both institutions for the MOU, that affiliation agreement, memorandum of understanding by USI and the organization are in place. It's important to remember that you cannot do clinical time until all your paperwork is processed and approved, and we call it green lighting. It's also important to remember that you have to communicate schedule changes to your instructor prior. If you're not going to clinical and you're scheduled for clinical, you need to notice. You need to notify us prior. Instructors are responsible while you're in clinical. They also can decide whether to count clinical or not count clinical. So it's important that you communicate, and communicating more often is better than not at all. It's also important that you communicate with your instructor issues that have arisen. Maybe there's a problem with your CNS that you're working with, or maybe there's a crisis that occurred in this unit and it's affecting your clinical time. Talk to us. Let us see what we could do to help you. But also reach out to us if there's other issues such as medication errors or needle sticks occur, because we are responsible and we need clear communication, and these are the requirements in those affiliation agreements that the institution is expecting things from us, and we're expecting things from that institution. Here are the resources and tools, just to give you a little overview of what we use. Obviously, many of you are familiar with Blackboard. It's where you go to get your syllabus, your calendar, your content. You also will find links to a number of USI resources within your Blackboard site. For the CNS classes, I use articles and links. There are textbooks that are related to the CNS role, but I'm very conscious of purchasing textbooks, so we will purchase textbooks and then we will use them for all 3 semesters along with other resources. We do exams. They are going to be scheduled on Thursday, and scheduled class meetings will occur on Thursday, and they'll be listed on your calendar and well discussed prior to the event. And I usually try to meet 2 or 3 times in the fall semester, 2 or 3 times in spring, and then summer, because there's more clinical hours, we don't tend to meet as much. But I think it's an opportunity for you to learn from each other and develop relationships so that you can reach out to each other after you graduate. You also use a tool called Castle Branch. Castle Branch is where you submit all your immunizations and other clinical requirements. You're expected to keep it update. The faculty receive notification if it's not. And if your Castle Branch is not updated, you can't go to clinical, and your clinical hours cannot count. So it's important to pay attention to your Castle Branch account. Typhoon is a web-based software to track clinical activities. So it will be a site that the instructor has access to, the student has access to, and the preceptor has access to. Because the preceptor will be doing their evaluations and verifying your hours in that system. So you can use it to determine what your tentative clinical schedule is for the semester. You'll log your hours, you'll provide clinical notes, and then you'll match that to what CNS competencies you think you're working on. So Typhoon becomes an important tool that we use to track clinical. I want to talk a little bit about UpToDate and Stat Pearls. UpToDate is a clinical decision support for health professionals. My understanding is if you talk to the leadership in graduate nursing, you can get a discounted rate for UpToDate as a student. So you may already have it. It's a great tool to have. Stat Pearls is a free service. You can pay a little extra for more service, but it is free. And it's a point of care and clinical support tools for health practitioners. Now, let's talk a little bit UpToDate and Stat Pearls. Remember, those are clinical decision support tools. So they draw from guidelines, from the evidence out there, to provide information to support that health professional and determine the plan of care. So some faculty, if you were writing academic paper, may consider those to be secondary sources rather than primary source. The primary source would be the guidelines, but they are excellent, easy to use tools that can help you when you're looking at determining point of care and what to do for patients. So these are excellent sites, so consider adding them to your repertoire. After graduation, USI graduates can seek certification through the American Association of Critical Care Nurses. The AACN is a great supporter of CNSs. Many CNSs belong not only to that organization, but also their National Association of Clinical Nurse Specialists. The American Association of Critical Care Nurses has always been a strong supporter of the role of the CNS. And so you could seek certification through them, depending on where you want to work. Or you could seek certification through the American Nurses Credentialing Center. And they also look at content from wellness through acute care and clinical sites such as med-surg, floors, step-down, outpatient. So there's a difference. More of this will be talked about as we get closer to graduation and think about certification, but it's always nice to know where you're going and to be thinking about it, because it will help reduce anxiety when you get closer. So I want to give you some resources. Dr. Bailey Rankin is our chair of the graduate program, and I've given you his office number and his email address. Michelle Wakewell serves as director, and she does a lot with the clinical sites and approves your preceptors. Any clinical forms would go to this USI nursing website for follow through. Tamara Hall is a great resource. She's a senior administrative assistant for graduate nursing. My name again is Dr. Mary Jane Swartz. I retired from USI several years ago, but remain as assistant professor of nursing in the adjunct role for the CNS program and in the graduate and doctorate programs in the nursing department. So to contact me, send me an email, and what we can do is set up a time to do an appointment via Zoom. Not a problem, and it'd be a great way to get to know you better. These are other helpful resources I've given you to both the certification sites, also our accreditation body, which is the American Associated Colleges of Nursing, and then I also gave you a link to the Organization of Clinical Nurse Specialists, Association of Clinical Nurse Specialists. It's a great site. I would encourage you to consider joining as a student. The cost is reduced for students, but it's a valuable resource. And we also are really have opportunities for students to be involved in the organization in a student role and to learn more about the policies related to the role of the CNS. So I'm excited you're here. I hope this goes a long way in helping answer some of your questions. Please do not hesitate to reach out if I can be of further assistance. Have a great day.